I'm with Dr. Salama right now, and Goldstein Garber Salama is incorporating, as I said, overall patient health into the practice. And one of the greatest wows of what you're incorporating is saliva health, right?
Yeah, saliva testing.
Saliva testing.
Yeah, it's amazing because most of the time people think of going to the doctor and getting blood taken from your arm or having to do a urine sample to be tested for things that are very dangerous and you need to know about. But actually in the dental office now today, we can actually harvest very important things from your saliva. And we all have a lot of saliva.
We do.
And it's certainly easy to get. So we can actually take the saliva and send it to a company that will test the saliva for some very important things. Number one, Tom, for instance, a lot of people may or may not know that they're susceptible to periodontal disease. Well, there's a gene, a piece of DNA in our chain that tells us whether or not we're susceptible to the disease. So you can imagine, as a younger person, saying, hey, you know what? You're more susceptible than the next person, so you're going to probably want to come more often and do a better job cleaning your teeth.
Right.
That's a health issue, because gum disease can cause heart and cardiovascular problems. Also, what we can do is we can detect what bacteria is in your mouth causing the problem, and then they can test that bacteria for specific antibiotics that will kill that bacteria. So we can then put you on the appropriate medication if in fact you need it. Another thing that's been amazingly important, and as an adjunct to saliva testing, just recently released, is that we can test for the HPV virus. That's a human papilloma virus. Big name, but very important, because what happens, Tom, is a lot of people don't know how important this virus is, because the human papilloma virus is a precursor to cervical cancer and many oral cancers. So if you had it, well, right away what we'd be able to do is start to let people that you know have it, that you have it, because it is easily transferable. You can actually give it to somebody that you love. So we'd want to test those people, see whether or not they contacted it. And then we'd also like to involve, your doctor, your physician, your ENT, and we then would also focus on oral cancer detection. And what we do from that test is, if you are HPV positive, we do transillumination. What we can do is take a light and we focus it on something that looks abnormal in your mouth. And rather than just say, hey, you have something abnormal in your mouth, we should check it from time to time, we can specify with transillumination whether or not there is peculiar growth of cells in your mouth.
Wow.
So that light shines up in your mouth. It turns a bright color, fluoresces, and we say, wait a second, that's not normal tissue. Only the abnormal tissue will light up. So therefore, we would know early on. And one of the first signs of cancer in the body actually shows up in your mouth. So, we're the first line of defense against a lot of very serious medical conditions.
Wow, so it's so much more than just brushing and flossing. It really is.
A lot more, a
And
lot
you guys
more.
are on the tip of the iceberg.
We're right on the edge. And in the future, as I said before, saliva testing is going to take on even more importance, because how much easier is it to get a test with saliva than it is with blood? So as these tests start to come to fruition, and it's happening each year, we'll be able to even detect more things that may be very dangerous to us as we get older, especially.
It's fascinating.
It is really great, and we're glad to be able to offer it to you.
I'm glad to receive it too. Thanks, Doctor.
Thanks, Tom.